Our speaker tonight is Jennifer A. Hansen-Moore, who is a PhD psychologist in the Pediatric Psychology program, as well as an assistant clinical professor of pediatrics here at The Ohio State University College of Medicine. She provides consultation and liaison services within the HEMONC, BMT, and Thrive programs, and she also provides outpatient services for youth with anxiety, mood, and habit disorders. Her research focuses on youth with a history of cancer or a disorder of sex development. So I just want to welcome everyone to our program. So without further ado, I'll turn it over to you.
Thank you so much for allowing me to be here tonight. So I think this is a topic that, while I'll present some information on it, I think we'll get the most out of your questions and our discussions about it. So I'm just going to present briefly about some of the background on this topic, and then we'll get more into your questions and discussion. So the first thing to really understand is that there is no right way to cope with cancer. So the child may express sadness or grief dealing with the loss of a healthy parent or a healthy household. They may express fear that their world is falling apart. They're afraid that their parent might die. I'm afraid someone else in the family might get cancer. I'm afraid something will happen to my parent at home and I just won't know what to do. They can also express guilt. So I'm healthy and my parent is sick. I can laugh and have fun and my parent can't as easily. They can express anger. In younger children, this is usually more because there's a change in routine or a change in terms of how often the parent is able to physically be there for them. And with older children, it can be a little bit more complicated than that. There can be anger at the medical team for the diagnosis. There can be anger at God for allowing this to happen. There can be anger at themselves for their own reactions to the situation. They can have feelings of neglect, so feeling left out, feeling like they're not getting as much attention as they used to, not knowing what's going on or really receiving updates. They can feel lonely and like no one understands truly what they're going through, least of all their friends, and they can feel kind of isolated. Maybe friends aren't coming over as much anymore, or friends simply just don't know what to say to them. They can also feel embarrassed about how to answer people's questions, or maybe even going out in public with their sick parent and having to deal with potentially people staring at them if there are any physical sequelae of their treatment. So most children do not experience a significant psychological difficulty when their parent is faced with a cancer diagnosis, but some children are at increased risk for what we would call more internalizing symptoms. So these symptoms include depressed or anxious mood. It can be things like over sadness, worries, constant worries about the family member's health, persistent worries about bringing home an infection to the parent, those types of things, and also worrying about upsetting the family with questions about cancer and treatment. We also know that these worries can lead to poor concentration, can lead to intrusive or unwanted thoughts or unpleasant ideas. And this can result in some difficulties in school, such as lower grades. There can also be some disruptive sleep. And sometimes we also see some somatic complaints, which would be things like headaches, stomach aches, things that are not necessarily related to a real underlying medical condition. And finally, research has shown that children tend to cope better when parents are feeling better. So you might see that when a parent is feeling the acute effects of a surgery or chemo or radiation, then their child is also feeling worse. But when they start to feel a little bit better, maybe when counts start to return, that tends to be when kids feel a little bit better too. And I think it's also important to keep in mind that not all outcomes are negative ones. There can also be a lot of benefits, which is hard to think about when you're faced with a cancer diagnosis, but there is a whole area of research in benefit finding in cancer. So we know that in many situations, cancer can actually strengthen the parent-child and really the whole family relationship structure. because there's more of a focus on what's important and less of a focus on petty squabbles. We also know that kids can grow in maturity over this process in learning how to care for others and making them more prepared for adult life by increasing their responsibilities in these areas. And studies have shown that children who themselves go through a serious illness or have a family member that go through a serious illness tend to be higher on things like empathy than their peers, and this is a skill set and a quality about them that will serve them well later in life. Going through this test can also strengthen a child's spiritual connection, just as it can in adults. And we also know that kids can be more tolerant of change and uncertainty, having to deal with all the things that you have to deal with going through cancer treatment. And this can teach them to be more flexible over time. They can also have some enhanced self-esteem, particularly if they have more of an active role in helping out at home or helping out with the parent in an appropriate way. This can help them to feel like they're important and that they have a very definite and important role. And kids also learn, just as adults do, really who their true friends are through this process, and that can also be helpful. And then finally, going through this tremendous stressor can really help them to hone in on what coping strategies work for them, and then using these coping strategies can be helpful in terms of future stressors that they might encounter in life. So there are a few things that can be most helpful for allowing your kid to cope positively. So the first and most important is really to keep the lines of communication open. Children should always feel that they can come to you with any questions. Some of my patients even use a special journal with their mother or father. This is just an example of one that I found online. But it can be a way to keep the lines of communication open by having them journal and write down questions and thoughts for a parent to then answer later. And sometimes being able to communicate in a less direct manner can allow them to feel a little bit more comfortable bringing up some of those more difficult questions or comments. So it's also always good to acknowledge your child's thoughts, feelings, and emotions. And while it may be a challenge, particularly during certain parts of treatment, keeping as consistent a routine as possible is helpful in making them feel a little bit more safe and secure. So we want to encourage the child to have normal activities as much as possible for positive distraction. And where possible, where there are some opportunities for that, including children in appropriate community cancer events. And then finally, seeking help from a professional if it seems like it's warranted. So commonly, a lot of well-meaning people automatically think, okay, you have a cancer diagnosis, your kid has to go in and see a therapist. And that's not always the case, and that's not oftentimes the case. So some things to look out for, though, to see if a referral to a mental health specialist might be warranted are to see if the kid, number one, is requesting to speak with someone, but also if they're verbalizing thoughts of self-harm, if they have some pre-existing mental health concerns, and we see that those concerns are being exacerbated since the diagnosis or since treatment has begun, then that might be a time to think about reestablishing care. And then we also want to keep an eye on behavior. So again, it's not uncommon for there to be some changes in how they behave at school, how they're doing in terms of concentration and sleep. But hopefully these are changes that are more transient in nature and are only lasting for a few weeks. So if you see persistent and serious changes in behavior, if your A student goes to getting all Fs, one semester, that would be the time to call somebody and see. Let's see. And oftentimes parents wonder exactly what do you tell your child and how much do you share with them. So we like to advocate that you do share with them some, at least, about the cancer diagnosis, just done in a very developmentally appropriate way. So many families are nervous because of pre-existing factors like pre-existing emotional concerns that the child might have. Is this something that's going to be too much for my child to handle? If there's another prior association with cancer, if the child knows someone in your family or in your community that has had cancer before or has passed away from cancer, still it's important to talk with these children about what's going on. So we do promote kind of open and honest communication, because it's better for the children to learn what's happening from you, because if there's secrecy, the child is still picking up through nonverbal cues and changes in routines that something is going on, and their mind will take them there. And they'll start to feel more nervous and worried if they don't know, if they're not getting a straight answer from the parent, or if the information they're getting from the parent isn't jiving with what's going on at home. So when you're thinking about talking with your child about cancer, give yourself time to prepare. Allow yourself to write down some notes if you want, but you certainly don't have to go off of a script. Figure out who you want to have there with you, whether it's your spouse, another family member, a friend, or someone from the community, or a mental health provider if needed. And then start with the 5 C's. So you do want to use the term cancer. You do want to let them know that they didn't cause it. The child didn't cause it. Nothing that they did or did not do caused it. That it's not contagious. They can't catch it. That's a common belief, especially among younger children. That it's not something that you can control or they can control, or even in many cases that the doctors can control. And also, very importantly, that they can still be a kid, that this doesn't mean that there's no fun. It doesn't mean that they're not going to be participating in other activities. So first, it's important to determine what the child already knows. So they might have some misconceptions about cancer already if they have some associations with cancer. Take time to provide some concrete examples and focus more on specific symptoms. So you do want to alert them to things like hair loss and nausea and things that they might see, or any surgical changes or things that they might see. Parents often, as many people will talk compulsively and quickly and talk a lot when they have something to say that is a little bit more emotion-laden. And so it's important to take a break at certain points and allow the child to kind of process and ask their questions. And it's okay to tell your child if they have questions about things that you really don't know about. It's okay to say, I don't know. And it's also okay to get emotional. This is something that is emotional to talk about, and it's okay for them to know that this is hard for you and that you're sad, but it's also important to convey that this is something that you guys will get through as a family. And also, where possible, tell the child what changes they can reasonably expect in terms of their schedule, their routine. Are they going to be spending more time at their grandparents' house or with someone else? Let them know a little bit more, as much as possible, how this will affect their daily routine. And also remember that when you do initiate that conversation about cancer, this is not the be-all, end-all conversation. It's just an opener. This is a conversation that will evolve and continue over time for years. So don't put too much pressure on yourself in that first disclosure. So for preschoolers, it's important to kind of keep the details to a minimum, provide very brief conversations. You don't want to give them a long, hour-long speech about what's going on with you, just very brief conversations followed by repetition. So this is something that you're going to be saying to them, maybe even some key phrases over and over again for them to internalize and understand. Keep it very concrete, so again, focusing on physical symptoms. Where possible, you do want to let them know about hair loss or changes because of surgeries. You can use stuffed animals and dolls to educate them about the location of the tumor. And you can use vocabulary that a preschooler will understand. So you might say something like, I have a boo-boo or an owie in my head that's called a tumor. And again, address any changes to their routine that might be reasonably expected. So for school-age children, it's important to determine what the child already knows, again, particularly if they have some prior association with cancer. Keep the conversations brief, again, with repetition, and give the child time to process. So be prepared that they might go off and play as though they're unaffected, but it takes kids a while to process, and they'll also process, the preschoolers and some of the younger school-age kids will process things through play a lot. So having medical play stuff available to them can be really helpful in helping them to process things. So children during this age can often show their responses through behaviors by being angrier or quieter than usual rather than using words, so you want to pay attention to their behaviors. And older elementary school children may already be familiar with some of the basics of the human body. So if they've already learned about the cells and in their science class or something, you want to take that into account when you're providing information about the cancer diagnosis. And children's books can also be very helpful. So these are two of my favorite, Know Where Hair and When Someone You Love Has Cancer. So when thinking about adolescents, it's especially important to be open with them, because if you don't give them the information they're seeking, they will find it on the internet, and I guarantee you they'll find things that you don't want them to find. So it's really important to keep an open communication and be respectful of their cognitive abilities and knowing that they can understand what's happening in the current moment and can also understand the implications of things down the road. So it's also important to know that teens may go kind of in and out of the situation. They may approach and want to be really involved, and then alternately may distance themselves and seem like they might be even more in denial, but that's just a really common reaction to kind of go in and out of the situation. And they should be encouraged to maintain outside interests and rely on friends and other activities for positive distraction. And it's also important to allow teens to have some autonomy about the situation as well. So whether or not you inform the school, I think, should play a large role in terms of what the teen's preference is and how much the school and their peers and things are informed. So allowing them to also act, if they want to, as the gatekeepers of that information for their social circle. So what to do if you have a child that prefers not to talk? So they may be protecting themselves from unwanted bad news, but the lack of questions and minimal sharing of feelings, of course, can lead parents to worry, are they really understanding this? What can I do to kind of get through to them? But I think taking the lead from the child and paying attention to what they want, so you're providing them with brief information, you're setting the stage for open communication so they can come to you when they want, and you're also allowing them access to other adults or support personnel, such as a mental health provider, that they can open up to, because it may just be that they feel nervous asking or feel worried about how it will be perceived if they ask questions to you about things. On the other side of the coin, you can have the child that is asking just tons and tons and tons of questions, and you feel like you want to try and get their anxiety under control. And so this can be another time when a journal or something can be helpful, just to help them structure and organize their thoughts and worries about certain things. So, but again, I think just maintaining those open lines of communication can help them to feel that they're included, but then also to feel that they're being supported. So the scariest question that parents are often concerned about is that question, am I going to die? And that is a pretty developmentally typical question for kids to ask, even as young as 3 or 4. So just because your child is asking this question does not mean that they're more distressed than they should be. So the important things to address, especially depending on the child's age, is to address what some of the underlying fears might be. So for younger kids, it can be sort of a fear of abandonment, a fear of what will happen to me, and those are things that can be addressed with them. So you can also just acknowledge these feelings and reassure the child that they will be taken care of, that they have ongoing love. And the important thing to do is you don't want to lie to them. You wouldn't want to respond saying, "Mommy will never die," or making a promise that you can't keep. So one way to respond to the question is something like, "Yes, sometimes people die of cancer like Aunt Holly, but my cancer is very different from hers. None of my doctors are worried about me dying, and neither am I. If anything changes, I will let you know." If the cancer is a little bit more advanced, you can say something like, "Yes, people die from my type of cancer, but I'm still really confident that new treatment will help slow down my cancer." So things like that. And then, as things progress, again, you want to keep an open and honest dialogue with them. And so the most important message is to know that this is not something that you have to do alone. You have support of friends and family, healthcare providers if needed, mental health providers if needed. The most important thing is to keep that open dialogue and to encourage the child to talk about their thoughts and feelings going through this process. Accepting the help when you need it from family members, friends, and neighbors, whether that's emotional support for the child or concrete help, getting the child to this practice or that practice, setting up a carpool, setting up help for meals, those types of things. Use your resources as you're able to. And seeking professional support when you feel that it's warranted, but again, hopefully taking away from this talk that there is no kind of ideal way to cope and that there are only a few situations where kids really need to be seen by a mental health professional. And then also seeking out local support groups through your religious organizations or through other cancer organizations, and informing your child's school to the degree that they would like, especially in adolescence. But in younger kids, always a good idea to make sure that the school is aware of what's going on.